Pink eye, or conjunctivitis, is a common and highly contagious eye infection that affects the conjunctiva, the thin, clear tissue covering the white part of the eye. Social awareness about pink eye diseases is crucial to prevent its spread and ensure early treatment. Educating communities about the causes and symptoms of pink eye is vital. Most cases are caused by viruses, bacteria, or allergens. Emphasizing the importance of practicing good hygiene, such as frequent hand washing, to reduce transmission. Encouraging individuals to avoid touching their eyes and to use tissues properly can also decrease risk. Creating awareness extends beyond personal habits to understanding the importance of seeking medical attention promptly. While viral conjunctivitis often resolves on its own, bacterial infections may require antibiotics. Allergic conjunctivitis, triggered by allergens like pollen or pet dander, benefits from identifying and avoiding these triggers. Promoting social responsibility in workplaces, schools, and public spaces involves encouraging individuals with symptoms to stay home to prevent spreading the infection. Clear communication about pink eye's contagious nature fosters a healthier and more informed community, contributing to the overall well-being of society.